In the first 24 hours of a major burn, your patient isn't just fighting pain. They're fighting for their life against hypovolemic shock. Okay, so let's master this using my 6-step framework for nursing fundamentals. Y'all, before we talk about fluid resuscitation, do me a favor. Hit that like button and share this with your clinical friends, and follow for more nursing hacks. Let's get this out to everyone who's prepping for their finals, okay? Drop a if you're studying burns right now. I don't mean to laugh. Okay, so step 1 is the patho breakdown, okay? When a burn occurs, the heat causes massive damage to the skin and blood vessels. This leads to increased capillary permeability, which is a fancy way of saying your blood vessels become leaky. All right, fluid, electrolytes, and proteins leak out of the vascular space and into the tissues, causing massive swelling and a drop in blood pressure. Step 2, risk factors. So we assess severity based on the total body surface area, or TBSA, okay, usually calculated by the rule of 9s. Patients at the highest risk for complications are the elderly, children, and anyone with a circumferential burn, which goes all the way around the limb or the chest because it can cut off circulation. All right, guys, I'm kind of under the weather myself, so if I'm nasally, or I sound hoarse or short of breath or whatever, that's why. I'm fighting for my life, my damn self. Okay. Anyway, step 3, clinical manifestations. So these are your signs and symptoms. We stage burns by depth. Superficial is like sunburn, right? Partial thickness involves painful blisters. Full thickness can actually be painless because the nerve endings are destroyed and the skin may look charred or leathery. This is called eschar. Okay. Step number 4, interventions. In the emergent phase, or priority is the airway and then fluid resuscitation. So we use the Parkland formula to calculate exactly how much lactated ringers and isotonic fluid, right, the patient is going to need. So we also keep them warm to prevent hypothermia, and we give them IV for pain meds, only IV pain meds. Okay. Step 5, labs. So in the beginning, your potassium will be high because the damaged cells release into the bloodstream. Because the damaged cells release it into the blood. Okay. Your hematocrit will also look high because the blood is so concentrated from fluid loss. Okay, so we also monitor your ABGs or arterial blood gases, especially if we suspect smoke inhalation. Step number 6, education and evaluation. For the recovery phase, teach the patient and their family about a high protein, high calorie diet to support skin grafting and healing. So we know we've succeeded when the patient has adequate urine output, meaning at least 30 to 50 milliliters per hour, and the vital signs are stable. So guys, that is burn care mastered in 6 easy steps. Okay, you guys are gonna crush your next simulation lab. You're gonna crush your next exam. All right, if you follow this 6-step framework. Let me know what topic you want me to tackle next. Leave it in the comments and I'll get to it. Okay, and guys, remember, I'm always leave you with this: never in this lifetime or the next dim your light for anyone. Stay lit.